Now we're going to talk about trigeminal neuralgia, or what is also known as tic Delarue. It's, according to the National Institute of Neurological Disorders and Stroke, trigeminal neuralgia is a disease that affects the trigeminal or the fifth cranial nerve. Occurs more often in people older than 50 and in women more often than men. How I kind of remember trigeminal neuralgia is if you look at this little picture that's posted right now. You see the lady and her right hand is up to the right side of her face. So you have 5 fingers. Trigeminal neuralgia, I mean, that's what people usually do, is they put their hand, because the pain is so severe, so cutting, so sharp, that they want to protect that side of the face. So you can always remember 5. Tic Delarue is the 5th cranial nerve, just by how the patient puts their hand up against their face. This also gives an illustration, the picture to the right, of the trigeminal nerve and how its branches come out and innervates the face as well. Let me see if I can make this move. I don't know if I can or not. Let's see. There we go. Okay, sorry. The etiology of tic Delarue is it's a chronic pain. Or chronic condition that occurs in people over 50 and in women more than men. Pain is usually unilateral, one side, and usually confined to the area innervated by the trigeminal nerve. It's thought to be caused by excessive firing of those nerve fibers and also by trauma and infection of the teeth, jaw, or ear. Pain is usually very sudden, severe, onset, often triggered when the area of that face is either touched or stimulated, such as when you brush your teeth, applying makeup. Sometimes just even a breeze can come by on their face and it will trigger that pain. So it's very, very, very sad because patients, they don't even want to smile. They don't want to, because they don't know what's going to trigger it at any given time, and the pain is so bad. So some of the causes, the usual problem occurs because of an abnormal contact between a vein or artery and the trigeminal nerve, and other causes that may cause those same signs and symptoms would include, MS, tumors, compression of the trigeminal nerve. So you have to rule those out. And those triggers, as I said before, there's triggering just, they can be talking, they can be putting on their makeup, encounter a breeze, smile, brush their teeth, stroke their face, shaving, which is just really, really scary for the patient that has trigeminal neuralgia. The symptoms may present with excruciating, sharp, piercing pain or jabbing pain. Between those pain bursts, which are known to last seconds to minutes, then they have no pain. The pain has cycles of what they call exasperations, meaning that it happens and then it goes into remission. However, the period of remissions becomes shorter and fewer, usually as the patient ages. The periods of active pain may persist for weeks or months, and then remission can last from days to years, so it's very, very unpredictable. Pain can be controlled by medications, injections, or surgery as well. Diagnosis of trigeminal neuralgia includes a neurological exam by the practitioner, and if the patient appears to have the trigeminal neuralgia, the doctor will try to assess and see what branches that's usually affected. Is the 2nd and 3rd branches are affected most often, but the doctor also may order an MRI to rule out MS or a tumor that's the cause of that facial pain. So we have to look at the differential diagnosis on that and rule those out. A CT scan sometimes is performed just to rule out any type of bleed or stroke. In the treatment of trigeminal neuralgia, the medication is aimed to lessen the pain. The first choice of drug therapy is Tegretol, which is an anti-epileptic, and also Neurontin, which is another anti-seizure drug. Lyrica and muscle relaxants such as baclofen can also be prescribed. Some patients also relieve pain with some complementary types of therapies such as acupuncture. There are surgeries that can be done on patients that have trigeminal neuralgia, especially when medical management fails. They can do what they call the stereotactic radiation treatments with gamma knife, hopefully not craniotomy, just because that is just major surgery. A nerve block, patients that have found that they had a nerve block and they took Tegretol, had the best pain control and compared to especially with others that only had treatment alone. Education in our patients is very important. They need to face a mouth care to make sure that they chew on the unaffected side of the mouth, which I don't think they need to be told that, because that's what they do notoriously, because they do not want to exacerbate any pain. Avoid eating hot foods or drinking hot liquids. Electric razor to shave the face, just in case. If they're shaving their face and they have an attack, an exacerbation, it may cut them severely. Eye care, when the eye is affected, something as small as rubbing your eye can trigger an attack. So if your eyes are feeling dry, the patient should be told to use artificial tears 4 times a day. The patient under a current attack is going to experience acute pain and be at risk for altered nutrition, less than body requirements, which are caused by the patient not wanting to eat during the acute attacks due to exacerbation of the pain. And the other nursing diagnosis, of course, is pain, that acute pain.